Yeah.
Thank you very much. Yes, I've just started recording, so welcome everybody to our COVID Community Champions meeting. And as usual, we're going to start with Anna Hartley, our Director of Public Health, who will give us some of our latest data.
Thanks, Tracy. And one of the byproducts of COVID is I can't see without my £1 stretcher reading glasses anymore. So I don't know how the 18 months of COVID has made that happen, but it has. And obviously I've not been around. I've been on holiday and I've also had COVID myself. So I had weeks off work with that. So I'm back now and in full health. But yeah, just not a right lot has changed in my absence. You can see that blue line is fairly sort of steady. We're seeing between 400 and 450,000 cases generally per 100,000. Sorry, 400 and 450 per 100,000 cases a week at the moment. So that is worrying. You know, we're not really seeing that go down. Next slide, please. So if we look at our rate, and it's down from last week, it's 442.3, but actually, you know, you do sort of wonder if that's just going to bounce up and down for the foreseeable future. And you know, it's concerning that our case rate in our over 60s has increased to 208.2. Well, it sort of slightly increased significantly, given, you know, a couple of months ago that was very low. And our positivity rate, as you know, that's for every 100 tests we send off, the come back as positive. Again, that's much higher than we'd like it to be. And if you look at some of our partners across West Yorkshire, Calderdale are really struggling at the moment. So they're starting to see worrying signs. So Calderdale today have had to take the difficult decision. The Director of Public Health has had to take the difficult decision to recommend or provide advice that schools have more restrictions in place. That can only be advice. You can't mandate that. But that really is in recognition of those high case rates and the fact that's now having an impact on things like the health and social care system. So we're not in that place in Wakefield, but we are keeping a very close eye on it. So again, really interesting to look at positivity. Just this gives you a sense of how serious you know it is within the different age groups. So if you look at our top line there, which is our 11 to 16-year-olds, it is a bit lower than it was a few weeks ago, but you can still see that's 35%. So that's for every 100 tests we're sending off. Given that we're still testing a lot of people, 35 of those in that age group coming back positive. So really concerning. So yeah, and you can see that Wakefield's positivity a bit lower than West Yorkshire and England, so that's good. But again, a lot higher than it would be. So what you would hope that indicates is that we're doing a bit more testing than perhaps West Yorkshire and England. So so this is a slide that I always found incredibly useful, because it really it's got your timeline along the bottom and your ages along the side, and it just really gets a snapshot, shows you where those very high case rates are, and you can see that, you know, those case rates amongst 11 to 16-year-olds, 1,922 per 100,000. I've got, and I've mentioned my children, the reason why I got COVID was my 14-year-old got COVID at school and came, well, I think she probably got it at school, came back and gave it to me. You know, I've got two children, I've got 3 kids, 2 are in that age and they both had COVID. I think we're all probably seeing the same thing with friends, relatives, and people in our community that I think at one point was more. At the moment it's 1 in 14 young people in the country have COVID. So where that becomes worrying is when we start parents and particularly unvaccinated people who link those young people getting COVID. So, and although we're vaccinating now, that will take a while for that to catch up really with our high rate. So again, this is just another way really of showing you that this is our looking at comparing our all cases with our 60 plus and our school age. So you know, we're worried about all ages. We're particularly worried about our 60 pluses because we know they're higher risk. Fortunately, that line's fairly flat. You can see though that school, the really big jump that you had in school age cases, and that has come down a bit, but you know, it's highly infectious. We know that because we're sending contact into school, those people are more likely to become infected. So that is a bit, it keeps children in one sense children education, but in another sense it also causes some risks around spread of infection. we just keep a bit of an eye on our rolling 7-day rate, and again, not huge amount to tell you here. You can see it's gone down a bit, not a huge amount. We'll just have to see what happens. So, so the darker the colour, the more cases we've got, and you can see with Featherstone there, it's 8. So again, very, very, very high rate. We enjoyed seeing this map go down to yellow, green with a few white bits on it. Probably 3 or 4 or 5 months ago, and now you can see that it is very dark, and that's right across our district. So we just keep an eye obviously on smaller geographic areas, but that's not what we want to see. So again, I always show you this slide. Keep an eye on hospitals, and you can see fairly stacked at the moment, and the same with our deaths. There's many more deaths we want to see, but we're nowhere near the place where we were for pre-vaccination. Yeah, so I think that's the end of it. There's quite a lot in the chat. If there's anything there? No, nothing for me there, I don't think. I'll hand on to our next presenter.
Thank you very much, Anna. And I'm really sorry, folks, we went skidding past the agenda, and I forgot to mention that we've got Darcia who's going to give us a vaccine update along with her colleague Sarah. And then we've got Helen Morris from Age UK to talk about a review of the bereavement and loss service. And Charlotte Parker from our comms team will give us a whistle-stop tour of the autumn-winter plan. And then we have Will Moore from Wakefield Trinity Trust to talk to us about a project that he's been working on. So we've got Darcia Farmer next. Thank you.
Thank you, Tracy. So in terms of vaccination update, we have started with the 12 to 15-year-olds. So that's the healthy 12 to 15-year-olds who are being offered 1 dose of the COVID-19 vaccine. It is Pfizer that they are being offered. And we have started the work through some of our local schools and high schools. But we are also looking at work in terms of those who are not in school settings. So for example, those who are homeschooled. For those who are 12 to 15 years old and are clinically extremely vulnerable, therefore at a greater risk of COVID-19 complications or household contacts or severe immunosuppressed individuals, those will be receiving 2 doses, and they will be invited via the NHS, so they are not included in the school programme. Just a little note in terms of our walk-in clinics, and we do have information in later on in the slides. Our walk-in clinics, so you may have heard us talk about the Grab a Jab. Those are currently for those who are 16 and over, and I've included the link to our Wakefield to the NHS side, to CCG side. So alongside the 12 to 15-year-olds, there is the booster program, which we mentioned in the last update, and it is based on the JCVI recommendations. And this one outlines those who will be offered the booster vaccination. So starting with those living in residential care homes and older adults, and we are also looking at health and social care workers in the some of the first groups. Those who are eligible will be contacted by the NHS, so either through GB or National Booking Service. And we are currently working towards timings of at least 6 months, or if we look very specifically, 182 days, which would be the earliest at which point a patient would be invited to booster vaccination if they are entitled. And again, so do a reminder around vaccination and keeping up with other vaccinations appointments, especially flu. For anyone who is eligible, please do come forward for the appointments. There are various appointments either through GPs or local pharmacists. The booster campaign is different from the 3rd dose. 3rd dose is those for those who are severely immunosuppressed, and they will be invited through consultants or GPs who will arrange their vaccination. And away from or on top of the 12 to 15 booster and 3rd dose, also, we also have the evergreen offer, so that means that anyone who is eligible that hasn't already had their 1st or 2nd dose is still able to come forward and be vaccinated. That one is looking into more technical detail, and I will hand over to Sarah, who will take you through that one.
So in relation to how Wakefield is doing in terms of our uptake, we had really good uptake from the people who were most at risk, back in the winter and early spring. So we have well over 90% of our most vulnerable population have had their first dose. We've got nearly 3/4 of those younger age adults in the 18 to 49 year old group who are not at higher risk, but have taken up the offer of having at least one, in many cases 2 doses of the vaccine. And we're currently actively inviting 16 to 17 year olds. So if you have a 16 to 17 year old in your household, they may be receiving an invitation or a reminder to get their vaccine. And we're already well past the halfway mark with that age group. So we're well over 50% of those young people have taken up the offer. As Darcia mentioned, we've already started this week vaccinating in schools. We've got a packed programme of vaccinations moving through the schools across the district in the 2 weeks before half term, and then starting again the week after half term, with the majority of delivery being during the school day. And there will be mop-up arrangements where children aren't in school at the moment, either because they're unwell, and occasionally where someone hasn't made their mind up or hasn't been able to consent at this point, but then decides later on they want to take up that offer. And we believe that once the programme in schools ends, there will be some offer available for people to go to vaccination services, but that's not yet open for people. At the moment, we'd encourage people, unless they're home educated, to access the offer in schools. And that programme's going really well, I have to say. And then, as Darcia mentioned, the boosters are being offered to people who've passed that trigger point of 182 days, which is about 6 months. We know that in Wakefield, we have about 160,000 people who will be eligible for a booster in the current programme over this winter. And I'm pleased to say that as of the end of last week, we were getting close to having already covered 10% of those. And I can tell you that I'm confident today we will have vaccinated or delivered our 20,000th booster vaccine in Wakefield. So that's 20,000 people who've had their immunity reinforced with a booster, which is really, really good progress. I thought it would be interesting to share that we're slightly changing the way that we're providing the programme this winter. And so this is applicable to people who either are coming for their first or second doses, because they're not yet fully vaccinated, or for those people who are taking up the offer of a booster. So on this slide, you can see a map of Wakefield, and on it you can see some green sites, which are the primary care network sites. People will be familiar with Sandal or Senswithin's Community Centre near Wakefield, Castleford Civic Centre, and the Churchview Medical Practice offering vaccinations through the primary care network. So those are the green blobs. The centre of Wakefield benefits from the mass vaccination centre at Navigation Walk as well, which is in that little circle with a 3 in it. And then the purple is interesting. So we have had 3 community pharmacies supporting us up to now, but as of last week, we have some more coming on stream. So by the end of this week, we will have 9 community pharmacies offering vaccinations in their own clinics in their own locations. So the ones which are shaded on there are the ones which are already operating, but the new ones are in a solid purple colour. So you'll see that whereas in the east of the district we only had Pontefract operating, we now have sites at Nottingley, Featherstone and Normanton coming on stream. And in the southeast of the district, where we only have a primary care network at South Kirby, we're having a new vaccination centre site opening in Tesco's at Hemsworth. And then as you move back towards the centre of Wakefield, we already had the Morrison's site operating, but we're now going to have 2 community pharmacies, one in the centre of Ossett and one in the centre of Horbury. And that helps to take pressure off services, but also make it more accessible for people. And we know the ones that have opened already, particularly the site in Normanton, have been able to vaccinate or serve a lot of people with their first dose because they'd not really thought about having it before until they saw that it was available on their own high street. So that was really good news. And then just to share some of the challenges. So from the point of view of the people in my team who are operating the programme, It's quite difficult now for people to follow the messaging sometimes, because the JCVI advice that they're receiving is quite complicated. As Darcy's just outlined, we have different vaccine types. So we're not in the same situation that we were right back at the beginning of the programme, with maybe just 1 or 2 vaccines operating. Some people only need 1 dose at the moment. That is the advice from JCVI. Some people require a 3rd dose, but not yet a booster. And then other people are ready to be boosted and have their immunity reinforced. So we reach out to people in lots of different ways. The people that we're particularly keen to get in contact with and offer a vaccination are those people who've never taken up the offer of vaccination at all. And there is an evergreen offer, no questions asked, if people do want to take that up. We're also keen to get those people, particularly those people with underlying health conditions who haven't come for their 2nd dose. We'd love to give them their 2nd dose. And then that means that they can then go into the waiting pattern for their booster a few months on from that. We'd like to offer them that 2nd dose. And again, it doesn't matter if you're overdue, you can come and get that 2nd dose. You haven't been disqualified in any way. And we're also at the moment keen to find ways to reach out to some of our 16 and 17-year-olds who we aren't able to offer the vaccination through their attendance at schools and colleges. And we've got some quite innovative ideas coming forward in ways that we can do that, to make sure that it doesn't disrupt them beginning their working lives, or them taking up apprenticeship places through ill health. And then just in terms of our operational tactics at a programme, we're constantly responding to differences in uptake and the different requirements of the programme as we're asked to deliver elements of the government programme. So we're always aware that when people are getting their invitations for their boosters, some of the processes that are operating in the background to make sure that they're invited in a timely way are balancing how long it is since they had their 2nd dose with their risk. And for that reason, just letting people know that if you feel like somebody who you know was vaccinated at the same time as you in the spring has been invited a little earlier than you, it may simply be because they've had a few more birthdays than you, and therefore the risk assessment is putting them a little bit ahead of you. But you should only expect to see maybe a delay of around a week at the most in when you're invited. And we know that people's immunity after they've been vaccinated doesn't decline sharply. It just does slightly decline. But there's no kind of need to be concerned if you're a week or 2 past that 6-month trigger. And then at an operational level, what we're always doing is trying to get the right mix for Wakefield of the availability of bookings, because some people like to make an appointment, and then also offer some walking capacity. And we do have good walking capacity at the moment at Navigation Walk in the centre of Wakefield. They're operating from 8:30 in the morning until 7:30 in the evening, which suits many people. And they're doing that right across the week, which is really good. And then we will continue to offer pop-ups, and where applicable to particularly the housebound, a few people will be offered their vaccine, in particular their booster, via a home visit. So we're always trying to balance getting the right way of delivery so that people can access their vaccine. Thank you.
Thank you, Sarah. I wonder if I might be able to ask a question of you, please.
Yes.
Thank you. So can I just clarify that some people have 2 jabs and then a booster, but some people who are immunosuppressed might have 3 jabs and a booster. Is that right?
Correct. That's correct.
Right.
Yeah.
Thank you.
I'll hand over to Darcy now.
Thank you.
Thank you very much.
That's all right. So in terms of walk-ins, and I know there was a question in the chat in terms of walk-in for appointments. So although we've put it into the chat box, there is a slide with information and a link to the Wakefield CCG website where you can find updated information on any walk-in clinics where you can get either 1st, 2nd dose or boosters. That information is being updated. So if you see information there, those are the clinics that are running. If there is no information, that means that we haven't got any scheduled, but that information stays in terms of appointments being still available for booking through the National NHS website. So we've included that for those who need to do it via telephone, the 119 is the way or opportunity to book it. On the last slide, we just have, oh, we're done. Just to say, in terms of the Wakefield CCG website, there is a lot of information that we are updating on a very regular basis. Things are changing quite quickly. I think Sarah would be the first person to say things are moving at a fast pace. So please look out for the information. Also, our social media do carry quite a lot of information. I think in terms of the question for our children 12 to 15 who are eligible for second jab.
Would you like me to take this one, Dacia?
Yeah, would you mind?
Yeah. So because children who are aged 12 to 15 ideally need to attend their primary care network site, so they need to make an appointment through their GP. We expect the GPs will invite you, so don't be concerned if maybe the 8-week point is going to be passed in the next week and you haven't heard anything yet. But if you do get to that point, it's worth giving your GP a call and asking if you can make an appointment. And the reason for suggesting that a 12 to 15-year-old goes through their primary care network is there's always an emphasis on making sure that the person who gives them their vaccination is familiar with working with children and the requirements of children, and so they'll be treated by the right workforce. So it may be that a specific clinic is offered and a batch of children are done. However, it depends on the child, and often what the primary care network will do is they will offer an appointment at a time that is convenient, but that maybe is towards the end of a session when it's getting quiet, so that if the child's a little bit nervous, that there's no need for that nervousness.
Thank you very much. I'll pass that on to the champion who submitted the question. Thank you. So do we have any other questions, please, for Dacia or Sarah about the vaccination programme? If you don't want to speak and be recorded, you can put something in the chat. And as ever, you can email us on ccc@wakefield.gov.uk. I can't see any...
There is one in the chat, and I'll read it. Sarah. Oh, I'm not sure whether we might have answered that, but a specialist clinic was set up for the first vaccine. Is this still being planned again? And that was in relation to clinically extremely vulnerable children.
There are some children who benefited from a session or from one of a series of clinics that were arranged with specialist supports from nurses used to supporting with or place specialists used to supporting children with some specific conditions. So if your child fell into that group in the first in the first round for their first vaccination, it's likely that they will be invited to something similar for the second one, if you think that is appropriate for your child or for that specific child.
That's brilliant.
Could I ask a question, please?
Yes, please do.
Thank you. I think I might have a few questions actually, if you don't mind. Sorry, you can see me now. Hello. So I'm Lisa, and I've got a few questions just around people who may be at high risk within a household and getting their jab. So if it's after the 182 days, if there is one person within the household who is either immunosuppressant or if they are at high risk, does that give permission for the whole family within that household to go get their booster, providing that's after 182 days as well?
Yes, they should be invited, because the national booking system will detect that they've gone past their 182 days. So they should be invited. So, but with the proviso, with the adjustment that actually it will still look at their risk factor. So they might find that they're not all called on the same day or at the same time. Right.
So if somebody's a parent, for example, of somebody who is immunosuppressant and they are 182 days past their second vaccine, although you've just said that it'll look at their risk as well, if they're a parent of someone immunosuppressant, does the system understand that, even though that person themselves isn't immunosuppressant?
I don't believe that it does. So if they did want to, if they are past the 182 days and they want to contact their GP, it may be that an appointment can be offered that way. However, we would expect them to be called in early November at the latest.
Right, thank you. Just
that would apply if they were if they were maybe younger.
Yeah, and thank you. And also around high risk and immunosuppressant. Say for example, earlier in the year when vaccine 1 was distributed on the terms of their risk factor, what if that risk factor has now changed in the meantime? Will the system understand that?
Do you mean if their risk adjustment if the risk is reduced?
Has increased. So if they were, vaccination 1 period, they weren't brought in early because they were extremely high risk, but now their medical status has changed, that now they are. Will the system understand their risk?
Yes, my understanding is that both the national booking system and the arrangements to identify lists that are used by GPs in their systems, they will both look for people who are in the highest group and therefore the highest risk group, and therefore the people who need to be called earliest. But we know that the national booking system will then slightly adjust the order in which it calls people to take account of how long it is since their second dose.
Thank you. And just to explain, the reason I'm asking this is, without going into great detail, during the pandemic, my risk did change. I was actually ventilated because of COVID. I nearly lost my life, but I'm here. But and the hospital explained to me that I was now extremely high risk. My body's proven how it reacts to COVID, and the likelihood of that happening again is increased. But getting my GP to accept that there was a lot of there still is a lot of challenge around that, as though the GP was wanting communication direct from the hospital to confirm that. However, I have seen a different GP within the surgery, and then they've looked at my records and said the fact that you had double COVID pneumonia and hypoxic respiratory failure, blood clots, and ARDS, yes, you're in the highest risk. However, I'd speak to my GP practice on another occasion and no one can confirm what list I will be in or whether I am high risk. And my GP practice did mention that I did slip through the net, but I seem to be finding it hard to get that confirmation of, am I no longer slipping through the net? Have we got things right? So that was my reason for asking. Thank you.
I appreciate it, and it's obviously unnerving, but good to still have you with us. Yeah.
Thank you.
Thank you very much, Lisa. And I echo that. We're very glad to have you with us. And I do hope that gets sorted out soon. We do have people on the call. We've got Darsha from the CCG, and we do also have colleagues in Health Watch that do support us to try and get things right. Thank you for sharing.
Thank you.
And there were excellent questions, actually, because I'm sure there'll be other people that are quite worried thinking the same questions. So thank you very much.
They were excellent questions. I was writing it down.
Fabulous. Thank you, Darsha.
Before Sarah disappears, there is another one around the specialist clinics from Amanda. So when are the specialist clinics? It is nearly 8 weeks since the first clinic.
I don't know yet when they are. We are meeting on Tuesday with primary care network leads, so with the GP leads, to talk about their planned activity for the next couple of weeks, and I'm pretty sure that we'll be discussing that there. The 8-week trigger, if we're approaching that, obviously that does mean that we need to get those in the diary now. My recollection is that they all ran either the last week in August or the first week in September. So yeah, you're correct in saying that they're due in the next 2 weeks or so. But yeah, don't be concerned. They certainly haven't been missed.
Thank you. I've also seen message in the chat, are the flu jabs being given at the walk-in clinics, or is that just through your GP?
I can pick that up if you like, Darcia. So the provision of flu jabs does depend on the setting. So at the moment, if you are due your COVID booster, you can get that at Navigation Walk at the Mass Vaccination Centre, but they're not offering flu jabs. But the majority of GPs and community pharmacies are able to offer you your flu jab. What we would strongly encourage people, though, is don't wait to have your COVID jab if you're due, just because you can't get your flu jab yet, and vice versa. Do get vaccinated with either, because we expect that this winter either of those could be still quite prevalent, and it's better to get vaccinated than wait.
Thank you ever so much. And I'm really sorry if I'm going to cut people short, but I am just conscious of time and we have got other things on the agenda. So please do send your questions in and we will endeavour to answer them. But I would like to hand over now, please, to Helen Morris from Age UK, who is going to talk about the bereavement support mapping review.
Thank you, Tracy. I've just got 3 slides, so I'll be very quick because I'm very grateful to be squeezed in. Okay, so I'm involved in supporting the Mental Health Alliance to run an all-age review on services and support groups to provide levels of support around bereavement and loss. It is essentially a bereavement review, but we're also trying to pick up if people have other types of loss that need supporting that could go on to cause mental health. So we're approaching it in a number of ways. And I have a graduate helping me, Amajuma Abule, who's been doing a lot of our interviews for us. So that's the name that you see there, as well as mine. So this review was commissioned by Michelle Esro, and we are leading with it, but we're working very closely with lots of other groups. So we're working very closely with Emily Castle, for obvious reason, Young Lives Consortium, because it is all age. And we're working with other partners within the district to make sure that we're finding as many people as we can to talk to. The 2 aspects are mapping the services and groups that support people who've been bereaved, and the referral networks between different levels of support and specialisms. So we're very conscious that a lot of groups in the community, particularly during COVID, where, you know, the massive increase in deaths, obviously, and some very traumatic situations for certain groups within the community, that groups were trying to help people through those situations. And it's not necessarily just the specialist area, like Prince of Wales for the adult sector, and of course Star Bereavement, who assist younger children. But also lots of different groups that help with bereavement, help people cope with it, get practical support, and, you know, indeed refer up to different types of organisation. We're obviously aware now of things like bereavement by suicide, where there's been special provision put in by West Yorkshire and Harrogate, and also bereavement through, for example, substance misuse, which is some very clearly traumatic areas. There are also areas in children's sector, or parents losing babies and miscarriages and so on. So we're trying to map as widely as we can what support is available. And that's within the community, commissioned services, but also the web now, because people are reaching out onto the website more than they were before. The other thing that we're trying to look at is finding out what the gaps are that people think within bereavement itself, within the whole area, and also other types of significant loss. So, for example, we're encouraged to find that most services that support that bereavement, whether that be a friend, a relative, a spouse, a partner. You know, it has opened up a lot from being strictly a relative of many years ago. But we're also trying to find out if there are areas that should be covered that are not covered now, and particularly in the children's area. So there's the 2 things that we're doing. So if I can go to the final slide, and then I'll finish up, I'll wrap up. Thank you. So in terms of participation, we've been doing video interviews with known providers and group leaders. We've done 26 to date, but we are now starting to run towards the end of the project. So we've supplemented this with an online service provider / group leader survey to try and gather as much data as we can because it closes at the end of the month. It closes in October, and I've put the link there. I'm hoping that these can be shared, Tracy, but that's the link. If any of you know groups within your communities, or indeed you lead a group within your community, and you'd like to get their opinion on bereavement support in the district, then that's the survey to complete. It will help us in two ways. It will help us find out that they are there and that they are offering some kind of support, and how they refer on to other organisations. And then what we're also doing is, for people who are serving an adult group or an adult service, we're asking if people who have experience of bereavement themselves, or maybe somebody close to them, to share their opinions. And that's, was there enough support? Was it quick enough? Was it the right level? Did it cover the right things? But we're restricting access to the services and groups that we've identified. So we're not trying to push this out on social media. That was a thought, to be honest. But bereavement is such a sensitive area, and particularly seeing as we're just coming out of COVID, that we wanted to make sure this was sensitively delivered. So we're putting that survey only through the group leaders that we've identified, and we're asking them to ensure, with their knowledge, that the resilience of participants, and to support them where required. We don't want to, we don't want to cause renewed grief and distress in doing this. We're just trying to find out as much as we can about the situation. For the children's sector, we're not doing that at all, because obviously that is a completely different area and needs specialist support. But luckily we've got Emily Castle helping us in this, and she's arranging a very small number, but highly supported groups, where children who are thought to be able to cope with the discussion topic, but also in the presence of trusted adults and specialists, can give their voice to the review as well. So my ask is this: I know you've been talking about lots of serious stuff with the vaccinations and so on. It is a survey. I know it's trying to find out information that will be helpful, hopefully, going forwards. But if you can promote this within your communities, I would be very grateful. And the survey closes on the 25th of October, so it's a sort of a quick hit. And if you can do this for us, that'd be great. Thank you very much. Any questions? Sorry. No. That's
excellent. Thank you very much, Helen.
Thanks, Tracy. Thank you very much. Thank you, Darcia.
Thank you. And now, Charlotte, I hope you can talk fast. We've got Charlotte from our communications team, who is going to talk to us briefly about our autumn and winter plan. Thank you, Charlotte. Over to you.
Yeah, no problems. Yeah, I'll try and keep it short. So probably everyone, as you're aware, the government recently announced 2 winter plans to keep us all safe during the winter, reducing the pressure on the NHS. I think we all know that winter is a difficult time for health and social care services, and obviously COVID-19 is obviously going to put extra pressure on them. So Plan A is what we're in at the moment. So it's seen the government offering the booster jabs, continuing with the promotion of the vaccine, continuing with test and trace, PCR testing, and encouraging the other winter vaccines, and reminding people of key health behaviours. And then if if cases do rise at a rate that's putting services under too much pressure, then the government will action Plan B. So Plan A, I think I've more or less covered it in that last slide, but Plan A aims to promote the vaccines, both the flu and the COVID booster, identify and isolate positive cases, so that's the test, trace and isolate, to support the NHS and the social care by managing pressures and recovery services. It wants to advise people on how to protect themselves and others, and not really applicable for our communications, but as communications as a whole, it wants to pursue an internal approach, helping to vaccinate the world and manage risks at our borders. And then should we go into Plan B, it will prioritise measures which can help control transmission of the virus. So it will communicate clearly and urgently to the public that the risk has increased and that we all need to behave more cautiously. It will introduce mandatory vaccine-only COVID status certification in certain settings. So that's places, big events, and places like nightclubs that have got a lot of people gathering. And it will legally mandate face coverings in certain settings. So again, in indoor settings, most likely. And then should Plan B happen, the government will also consider asking people to work from home again. So our winter plan, we've looked at Plan A and B, and our objectives will help deliver these Plan A, hopefully. So we want to achieve maximum take-up of vaccines across the district. We want to encourage testing uptake across the district, and we want to provide support to our partners by sharing their communications campaigns to reduce pressure on health services. And throughout the winter, we'll reinforce key public health messages as well to reduce our infection rates. And we want to support local businesses to respond to these changes and protect their employees and customers. So I should have put 7 key behaviours, but it's actually it says 6. Obviously, the main key behaviour is for everyone to get the vaccine, but I've missed that off somehow. Other key behaviours are let in fresh air, wear face coverings, test and isolate, stay at home when unwell, not just with COVID, but with any illness, so that we're not spreading it around the community, which would put extra pressure on health services. Practice good hand hygiene and use the COVID-19 app where businesses ask you to, so we can track and trace. So hopefully people will be familiar with the Let's Keep Life Moving campaign. So we've winterized the campaign. While we're in Plan A, we're doing social norms marketing, which means that we're trying to embed the message into people by showing other people, leading by example. So this is fresh out yesterday, so this is the only asset I've got, but there'll be various photographs of people practicing the behaviours that we want people to do. So in this case, it's I'm wearing a mask this winter to keep my business open. So the overarching campaign is called Let's Keep Life Moving, as I've just alluded to, and all our campaigns will follow that look until we get to Plan B. So on the plans, we've got seasonal campaigns, and my colleague George is going to come on and talk about Halloween. So we're going to play on the Halloween bonfire night and Christmas messaging to make sure everyone's safe, but also have a bit of fun with some Halloween puns and some Christmas puns and things like that to sort of put the message out in a fun but obviously reminder way. Obviously, our vaccine campaign supporting the CCG continues, as does our booster and flu campaign. Our older people campaign, we're looking at other channels to get to the over 60s. We're finding there's a bit more of an increase in rates in that age group, possibly because people are feeling more immune because they've had the boosters as well. But just to really reiterate the public health messages and looking at obviously you guys to help us in your communities and other channels that we maybe haven't considered before. There's a big ventilation campaign, so it's essential that people refresh the air before receiving visitors and after. So we've got some key messages on that, which I'll send to Tracy and she can forward it onto the WhatsApp group. And we're also working with businesses to promote that within businesses as well to keep employees safe. With the ventilation campaign, there's a caveat that obviously we want people to keep warm because being cold obviously can lead to winter deaths. So we've got the caveat of how people can keep warm and the fuel poverty information that the council can support with on our key messages. And then launching this week, we've got our Be Prepared campaign. So whether we go into Plan B or not, we want to make sure that businesses are aware and can prepare in advance. If Plan B is actioned, we get a week's notice. So the more we can do before Plan B is actioned, the better. So we're providing toolkits for businesses about how they can be prepared and posters that they can put up in their business that are pre-printed and can be put up in businesses as soon as the government say Plan B is actioned. And then obviously if Plan B does happen, we will have to review our communications and respond to what the government advice is and communicate with residents on those areas. And then I've just mentioned Halloween. George is just going to speak. He's come up with some really good puns to make it a fun way to look at trick or treating while we're reinforcing our good behaviours. So I'll hand over to George.
So what we've done with Halloween is we've created a series of 4, which we'll show it in order. Using some puns to sort of embed the current message of let's keep it moving this winter campaign, but also making it fun. So there's two ways of looking at it. There's those that are providing trick or treats. So people in the home setting, asking them to, sanitize the area before they put the treats out, put them in bags so it's not loose treats. And then to have an area where people can pick things up so that we're maintaining social distancing. So then for people that are out trick-or-treating, it's a matter of them reminding them to stay in the groups, to wear masks, to take sanitizer with them so that they can sanitize when they've picked up treats and things like that. So another key message is that not everybody wants to take part in trick or treating. So for people to be mindful that if they go knock on a door and it's not answered, it's people not wanting to take part because they don't feel safe to do so. So we want to remind people to have fun but be respectful of other people. And then that's just one of them. So these will, all these 4 slides that you've just seen that we've created will be used for social media, and we're gonna we possibly are going to put them on digital billboards as well. Okay, thank you.
Fantastic.
Yeah.
Thank you very much, George. I love those. And as always, our COVID champions have been sending information and messages which help to shape some of these communication messages. Our comms team are really great at listening to what our champions say and try to tweak our messages to incorporate that. So thank you very much. And now we've got Will Moore from Wakefield Trinity Community Trust, who's going to talk to us about their project. Over to you, Will.
Cheers, Tracy. Hope everybody's okay. First of all, I'll just give a bit of an overview of what we do. So there's 4 departments at the Wakefield Trinity Community Foundation. This comes out of the Health, Wellbeing and Inclusion department, and we've obviously got 26 other projects that we also use with different demographics, so we can use to put our message across in terms of staying COVID safe and getting vaccinated and stuff like that. So the first thing that we did about when this project obviously got off the ground a couple of months ago was we tried to incorporate the rugby league theme around staying COVID safe and vaccination and stuff like that. So we created some graphics called Six Again, which enforced obviously the self-isolate, social distance, and stuff like that. And then them key messages we wanted to try and do it in like a rugby league kind of way. The next thing that we did was using our other projects, such as the Big Feed and Connect Again, was to try and target the older generation in terms of getting vaccinated and staying COVID safe. The Big Feed ran from February to around May time now. So we wanted to try and use that time in not just delivering meals to the elderly, but we also wanted to enforce the messages that obviously the NHS have been putting out. So we used to take meals, I think it's about 1,200 every single week, to different places around Wakefield, and we used to use our Six Again messages and incorporate them into the meals and make sure that everybody got what they needed to take away from that, other than obviously the hot meal. We also used our Connect Again project, like I just mentioned. We have 330 phone calls we delivered throughout January and February, and we also used this on a Zoom call as well. So we tried to push up our message out in a different sort of way, obviously to the ones that have been mentioned so far. I'm actually the media executive of the foundation. I'm not the health, wellbeing and inclusion manager. However, it's my job to try and push the messages throughout social media. So one thing that I did try and do, I got in contact with the NHS Wakefield, and they sent over a load of different graphics and social media videos that we could use and push out across our platform. We've got around 3,300 followers across our Twitter and nearly 1,500 on our Facebook. So we try to use them videos and them graphics to push out the messages around staying COVID safe and getting vaccinated and stuff like that. One thing that we have run into a problem with is the amount of players at Wakefield that have been vaccinated. It's actually quite a low number. And I've reached out to quite a few of the players, and some of them have said like, you can't use that because I'm not actually vaccinated, which is obviously a bit of a surprise, which is something we a bit of a stumbling block that we came across. However, we will try and keep pushing the message to them and see if we can use them as a campaign in getting maybe the younger people vaccinated, people who come to Wakefield every single week. One thing that we're going to try and do moving forward is using past players as well. Obviously, that might resonate with some of the older people who might not have taken up the vaccine. So I think that'd be quite a good way of incorporating that and using some of the players that might have been vaccinated, and we can push that message in a different way. With the obviously season now finished, it'd be quite hard to give anything out or anything like that at the stadium. But obviously, we can plan on doing that more in 2022. But other than that, that's what we've been kind of doing. If you've got any questions, let me know.
Wow, Will, that is excellent. Some of those statistics there are eye-popping. Well done.
Cheers, Tracy.
Do we know why some of your players have chosen not to be vaccinated? Have you asked them why?
I haven't asked them why, unfortunately, not yet. Anyway, I've reached out to a couple of them, some of the younger players more than anything, because I thought that might be a good way of getting younger people vaccinated. But they've all said no, and I've not had the opportunity to ask why as of yet. But it's something I can ask in the future, 100%.
Yeah, that's fair enough, and I guess it has to be a sensitive question.
Yeah, exactly. Yeah,
some people don't. Yeah, they don't always want to tell us why, but I like Lisa's just put in the chat. I think that she's willing to share her story to encourage vaccine uptake, and I've shared your email today, Lisa, with our colleagues as I've discussed with you via email. And I think if we have people's stories that explain why, and we've been doing some COVID hesitancy vaccine training for people, for our champions to take, which will help with conversations to chat to people about, you know, what is the reason why you've chosen not to, and is there something that you're not sure about? Because to make an informed choice is great, and that's a yes or no is fine, but is the choice being informed, or, you know, is the information that they're worried about something that we can alleviate maybe? But thank you ever so much for that whistle-stop tour. Does anybody have any questions for Will?
Well, we do offer vaccine hesitancy training as well, which you might want to do. You can just sign up. It's just like an online thing. I don't know when the next session is, but it's sort of really helpful around talking to people about vaccine hesitancy.
Yeah, and it helps to start the conversation, doesn't it, Anna? It's really good. I can recommend it. And that's available for all of you COVID champions. Thank you ever so much indeed. That was really good. We've just got a few more slides now, Sarah, before we wind up. Just a reminder that we've got help at the hubs. That is still ongoing. It's still available, and there's a link there for you. It's free for people to access. There are 9 locations around the district, and we'll share the link after the meeting. And the next slide, please, Sarah. I was contacted recently by one of our champions who said they'd received a letter in the post that looked as though it was from the Office of National Statistics around a COVID survey, but she wasn't quite sure if it was genuine or not. So I contacted the Office for National Statistics, and they said, yes, we are doing some surveys if you're interested in taking part, and she's given us some links. So if anybody does receive a letter through the post and you're not sure if it's genuine or not, because we know there are lots of scams, please do feel free to check those websites out. And if you want to take part in this survey, I'm sure they'd be very pleased to have your input. And just a reminder, this is one plug for me, that our Positive Mental Health Network meeting is this afternoon at 2 o'clock. I think some of you are members of that network, so we hope to see you at 2 o'clock. If not, people are welcome to join the Positive Mental Health Network. If you want more information, just email me. And one of the things I will be talking about today will be getting ready for Christmas. I know it's a bit early, but not last year, but the year before, we put together a list of places where people who are socially isolated and lonely might be able to get a Christmas lunch, or might be able to reach out during the festive season if they were suffering from any mental ill health, or they just wanted some support. And we got a list of support organisations that were open over the Christmas period, what they offered, where and when. And we thought, especially this year, if we could gather that information, that would be really useful to share. So if any of you are aware of anything that's happening around that time of year, please could you share it with us so that we can make sure that's distributed widely. So unless we've got any other comments, which I'm not sure that we have, I think Anna might want to just say a few words to finish off.
Yeah, just a couple of things. Firstly, the council have been audited on their quality and diversity work. That's going to be published openly. But one of the things that was really nice to see was that the community champions work had been identified as an example of good practice. So that was really nice to see. And then the second thing is, I just wanted to say a big thank you and a goodbye to Sarah Scott, who has been fantastic supporting these sessions for a long time. Is it, Sarah? Well over a year now. And has also been part of the public health team. And I think Sarah's got a great new role, haven't you, Sarah, that's a bit more community focused than what you've been doing for us. So thank you for all your hard work, and also all the best for your new role. I don't know if you want to tell people what you're going to do.
Yeah, thank you very much. Yeah, it's been a pleasure to be involved in this project and be involved with all you guys at Champions. Yeah, I'm moving to a community team, so I'm going to be a community engagement and outreach officer for Wakefield West, so you may see me around at some point. But yeah, start on Monday.
Great, fantastic, Sarah. And I think, you know, you'll I'm sure you'll really enjoy that, and there's some brilliant stuff going on in the west of the district, so get involved in that.
Thank you.
We'll really miss you, but it's great that you're staying with the council. Thank you very much. Thank you so much to all our speakers who've given you time today, and thank you for everyone for joining, listening in. Please do help to share these key messages that you've heard. Keep safe, and we'll see you next time. Thank you very much, everyone.